Well, good morning. Woo! Sitting down is not something I spend a lot of time doing, so I'm just ready to, do a yoga class or Zumba or something, so I apologize if I'm a little overly animated. I'll put my little thing up here. All right. Should we get started, or? Okay. All right. Perfect. All right. Well, good morning. My name is Valerie Lefler. I am, as Marcia said, President and CEO of Liberty Mobility Now. We are a small woman-owned business. We are a disadvantaged business enterprise certified by the US DOT. It took 146 pages of paperwork to prove that I am a female and I am qualified to run a business. So, just so you know, that's quite a process. So a little bit about our company. So that's myself before starting the company and trying to launch this. Since then, I think there's a few more bags under my eyes and gray hair. But so I started out at the University of Nebraska-Lincoln, managing transportation research, multidisciplinary, from I think 32 different engineering, social sciences, business, finance, economics, and really just got a look at the transportation enterprise, soup to nuts, managing, coordinating, herding cats. And I love that, but I wanted more connection with humans. So then I moved to the University of Nebraska-Omaha and worked in the College of Public Affairs and Community Service. With that project, got connected into public transportation, really at an intimate level, helping with Title VI compliance with the FTA, and also helping improve and streamline business processes within the DOT related to invoice manual development. During my time at the university, I met this young whippersnapper, Shashank Ajala. He is a computer science genius. He was a staff member while I was there as a student worker, helped us with our websites, completely overqualified, but he did a great job. Graduated, went on to work at HBO, UPS, and Capital One. And then I said, Shashank, I have an idea. Let's get together. So we worked on this project with the Nebraska Department of Roads to streamline business processes. And then we really found the opportunity that then started Liberty Mobility Now. So during the 2 years that I studied public transportation in the state of Nebraska with 58 rural public transit providers that were 5311 and almost 90 5310 public transportation providers, there was a lot of challenges. And we wanted to find a solution that overcame them. So there were counties with no service at all, which are the white counties on that map. There were county-city jurisdictional barriers, match funding, things where, literally people on boards have to pass away or, move in order to change policy. Adding vehicles to increase capacity because of Buy America standards sometimes takes up to 2 years. Coordinating schedules and pricing. I mean, who's going to charge what for the same ride, trying to coordinate those things was just insurmountable at times. It takes years. We ran into limited awareness of service. I mean, literally, the business across the street would have no idea that there was public transit in that building. Limited nights and weekend service. I think limited is an understatement. Few options for paratransit service. There was paratransit with a demand response. However, again, nights and weekends was not really an option in most places. And then urban taxis traveling to what I call frontier communities, 200-300 miles at a taxi rate to provide people to service. That's a lot of deadhead time. So we said, can we come up with a solution for all of this? So we put on our thinking caps, Shashank and I, and we said, we really have to find a solution that's customer-based. We need to use sophisticated technology that works on a low bandwidth because we are working in a lot of rural communities. And it has to work on any platform, iPad, Android, PC. Having specific devices was a no-go. It was a barrier to entry for use of that technology. We needed to use folks in the community. We needed to be able to optimize existing resources without asking them to change. We needed to be able to plug in mobility options where needed, and bottom line, quick to implement and afford. People need to get to the doctor today. After working in the state of Nebraska and listening to folks all over the country, lamenting these same challenges, I said, we're going to do something. So there you go. All right. So we came up with 2 solutions. One wasn't enough. So we have Liberty Connect, which is used as software as a service that connects customers to transit agencies, to human service, medical, and care agencies. Simple as that. Plug and play like Adobe, Microsoft Word. Then we have Liberty Now, that is basically a kind of an advanced mobility center that includes a centralized call center with mobility managers and using intelligent transportation systems. That's one thing when I was at the University of Nebraska and also with the regional UTC, we saw a lot of use of intelligent transportation systems. And then when I went to the rural communities, over and over we heard, we can't use technology in these rural communities. I said, I think we can. And by golly, we found a way. Local Liberty mobility managers, and I heard this term yesterday, and I love it, indigenous to the community. So they know the microcultures, the roads, which ones to go not down when it's snowing, things like that. And drivers as independent contractors. We wanted people to be able to be mobilized to help right away. So Liberty Connect is really designed for agencies providing transportation service, 5311, 5310s, nonprofits. It basically has a transit dispatcher platform that has a bus driver mobile application, a caregiver portal, and a mobile application for passengers. So Liberty Connect basically puts the caregiver, the bus driver, and the mobile application all connected to the transit dispatcher platform. So what does the transit dispatcher dashboard look like? So basically we have, the GIS location of all the vehicles that are currently in service. We have a ability to look at what vehicles need service. You can't see that really well, but that's looking at these 2 vehicles have low blood sugar. That's me right now. Have low oil or need windshield wipers. So we have a maintenance suite that goes along with it. And then this is the daily inspection checklist. So did everybody who was having a bus that day do their, checks? So basically a very simple platform. What we found is very often these platforms for public transportation agencies have a lot of buttons and a lot of things on it. It's not really intuitive. So that's one thing with Shashank's experience at HBO we brought to this platform. But basically from the caregiver, the local call-in dispatch that they normally operate, and the mobile phone application, all the requests go into a bucket. We decided that the transportation dispatcher at these local agencies wanted to maintain control and should have that control of their system. We have reporting, driver logs that gives by day, week, month, quarter, revenue miles, non-revenue miles, deadhead time, passengers, you name it. The Connect Caregiver portal connects hospitals, doctor's offices, so on and so forth for providing that input. The function is to book transportation and to track rides. The advantage, it provides flexible billing options, reporting, and reduces stress on the client agency, improves transportation. Liberty Connect basically gives the doctor's office the ability to see who's coming to their office, where they're at, and also if they need to contact the driver to let them know the appointment is done and they're ready to be picked up, they have that information. The bus driver mobile application works on iOS and Android, smartphone, tablet, whatever. They see their trips for the day. When their trip's completed, I have my animation backward here. They click that button, but they're able to basically at every step collect the GIS place and time of what is happening. That allows us to give that data, that reporting, that customer service information to be able to know what's going on, when and where, and provide notifications to the individuals who are using that app for the passenger. The GIS data is pulled every 3 seconds. Liberty Connect is a passenger mobile application. It's very simple, very similar to Uber or Lyft, and they can see their upcoming trips, and they can also, if you want to create individual trips for caregivers who are family members, you can do that as well and receive notifications. So in June 2016, we rolled this out. We are using it in Scottsbluff, Nebraska. We're expanding it to several sites this month, and also next we're adding credit card, distributed payment processing, customer satisfaction ratings next month, and then the following, automated ticket tracking, those little books and things like that we want to put on an app. Additional features, join us. We love user feedback. That is how we do business. We build the ship as we go down the road, or the river. Okay, Liberty Now, and I'm going to go through this really quick because I'm almost out of time, is really designed for non-emergency medical, non-medical, Medicaid transportation, statewide and regional mobility management, or community hospital access to care centers. It's a centralized call center, as I said, with mobility managers and intelligent transportation systems, local Liberty managers hired from surrounding community, and Liberty drivers as independent contractors. So one of the benefits of working at a multimodal center with research is I saw how the railroad industry worked. I saw how the shipping and logistics industry worked. And I said, there's a lot of data that they're able to do. Union Pacific, for example, manages 32,000 miles of track out of one room. They know every second that track is in progress. And so we said, we want to take that level of data and be able to track our high priority, high vulnerable dialysis, extreme Alzheimer's, so on and so forth, to be able to make sure they're getting where they need to go when they are. And if they're not, we're being preventative about that if we see that they're not leaving. Our dedicated mobility experts search for the best solution for the individual, looking at public transit options, nonprofit service agencies, Liberty drivers, possibly taxi, Uber, Lyft, volunteers, and family members. And then we use sophisticated trip scheduling technology and automated booking and routing in order to be able to make sure that individuals who have trips that can be reoccurring or do not need a human interface to set up that trip, it's happening intelligently and securely. That's our headquarters there in Lincoln, Nebraska. All right, so local Liberty managers, what do? They do local driver recruitment, screening, training, follow-up on customer service interventions if there was something reported. They do on-the-ground client customer service and education. They gather constant business intelligence about mobility options. We have a mobility champion circle that we set up with individuals in the region, consumer advocates, to make sure that everybody's on the same page about what's changing. Local public transportation agencies that I've worked with change what their rates are and where they're serving and how they serve on a regular basis, and simply pulling that information once a year isn't enough. And also they're able to be the emergency driver of last resort. We also give them a launch team with a 90-day support boost. We have folks that have over 40 years of experience in the Marine Corps helping us set up these logistics. We help them with community engagement specialists and also marketing. So when we go into a community, we look at the entire picture. The Liberty drivers are members of the local community. They set their hours in their service area on a weekly basis. Because we allow the pre-scheduling of trips from those caregivers, so on and so forth, the majority of the trips, when they wake up in the morning, they know where they're going. Customer service training is required for those who are handling individuals, or I should say transporting individuals who may have special needs. There's CPR, first aid, and also lap belt training required. It's full to 8 hours. They drive their personal vehicle that's clean and well-maintained. We also do random vehicle inspections. They have to pass a strict background check. We do fingerprinting, driver's license check, and we also inspect the title of their vehicle. One of the most important things with our Liberty drivers is 80% of the ride fare stays in the community paid to the local driver. That is so important in these rural economic regions where there's very few part-time jobs. 20% of that ride fare pays for the Liberty infrastructure. The two solutions work together. So now the Liberty Now automated or manual trip request can show up in that local transit manager's dispatching log. So a timeline demonstration, let's say from noon or from midnight to 7 a.m., the rides are referred to Liberty drivers automatically or manually by transit managers or mobility managers. From the time that the public transportation is available, the transportation is referred to them. And then after 4 o'clock or whenever the public transit is no longer available, the rides are referred to Liberty drivers. So we're just connecting. We put together an MOU to make sure we're all on the same page and we're working together towards the proper solution. Covering those gap areas. And these are individuals from our pilot community, but I'm out of time, so I'll have to tell you the story at lunch. So we're launching in western Nebraska in fall of 2016, and also in the Texas Coastal Bend region in the spring of 2017. Our funding has come for research and development from USDOT, Federal Transit Administration, the Small Business Administration. We submitted this phase 1 proposal. We're awaiting phase 2 funding. IGD is the parent company that this idea spawned from. Texas DOT and Motion Invest Nebraska are our venture capital support, and also we're working with the Coastal Bend Center for Independent Living. We have a website. You can sign up for updates. thisisliberty.com. We have several webinars. We have a Facebook page. Thank you.
That was terrific. Thank you, Valerie.